When we experience a loss, we rely on established rituals to help us process it. We hold funerals, we drop off casseroles, we send cards. But with infertility, none of that happens. This chart shows the path society expects grief to take. These rituals exist to mark a definite starting point. From that peak, we anticipate a linear process where the pain slowly fades and stabilizes over time. Society and the medical industry approach infertility as a clinical project, one governed by biological timelines, test results, and scheduled procedures. Behind those appointments, scheduled around work you can't explain, there is a profound internal reality. It is a recurring loss that arrives again every single month, devoid of the societal acknowledgement usually required to process it. Without external acknowledgement, many interpret this deep, persistent sadness as emotional fragility or personal failure. This chart compares severe psychological distress metrics across different diagnoses. The clinical data reveals that people navigating infertility experience distress levels comparable to those reported in serious medical conditions like cancer and heart disease. Feeling broken is the expected psychological result of enduring medical trauma, while society strips away the tools you need to process it. The distress of infertility is a condition known as disenfranchised grief, a profound loss that a person does not feel entitled to publicly name. This diagram illustrates why standard coping mechanisms fail here. Infertility rejects the linear resolution curve of normal grief. It operates instead on a relentless, recurring monthly cadence tied to treatment cycles. The internal toll of this loop is grueling, trapping patients in states of high anxiety, especially during those 2-week waits to see if a treatment worked. During this repetition, a psychological shift occurs. Your body stops feeling like a home and becomes a monitored clinical project. Then come the external shocks, like a pregnancy announcement that lands in a group chat with no warning, shattering your equilibrium. The true horror of the cycle is the isolation. You are caught in a repeating loop, watching the rest of the world move forward on a straight line. That isolation spreads outward. You feel a growing distance from friends whose lives kept moving forward while yours stood still. For couples, the cycle creates a pressure cooker, taking a relational toll on the very people trying to build a family together. This visualization maps the primary driver of partner strain. Partners frequently process the trauma and cope on completely different, unsynchronized emotional timelines. This desynchronization generates intense guilt when you are devastated while a partner or loved one is experiencing happiness or trying to stay hopeful. The cycle's ultimate trap lies in its lack of a natural exit ramp, leaving partners with no clear way to reconcile their conflicting emotions. If your grief is structurally cyclical, simply waiting for time to heal it is a mathematically flawed strategy. Time alone cannot flatten a loop. To process cyclical trauma, a person must step outside the medical loop. Therapy provides a neutral space to set the emotional weight down, distinct from the biological demands of treatment. A licensed clinician helps you manage the side effects of the cycle, processing the raw grief, repairing relationship strain, and navigating the decision fatigue of continuing or stopping treatment. Because partners are often on materially different pages, couples therapy is the most appropriate intervention to realign those unsynchronized timelines. Coping and Healing Counseling, or CHC, is a specialized practice equipped to handle this exact form of distress. CHC features a diverse, culturally competent team of licensed therapists. They provide HIPAA-compliant telehealth services, making care accessible by video across all 159 Georgia counties. They also remove the financial friction of seeking help. With Medicaid, there is a $0 copay, and most commercial insurance plans run just $10 to $40 a session. The medical cycle is relentless, but carrying its psychological weight alone is a choice you no longer have to make. Reach out to CHC today.